So let's finish up the final part of chapter 16. So much to know in this chapter. If you haven't worked with cancer patients before, this seems a little bit overwhelming. The more you work with these types of patients, the better understanding you'll have with all these terms and abbreviations, medications, and drug therapies. So just really get yourself familiar with this. So chemotherapy continued. So an intrathecal chemotherapy is the delivery of chemotherapy drugs into the spinal canal. Palliative chemotherapy is chemotherapy that is given to relieve pain or other symptoms of cancer but not cure it. Epidermal growth factor receptors, EGFR, inhibitor therapy are drugs that interfere with the growth of individual cancer cells. Hormonal therapy is the use of hormones to stop a tumor from growing or to relieve the symptoms caused by a tumor, or to replace the hormone that is needed by the body to function properly after a body part is removed due to cancer. Immunotherapy or biological therapy is a method of boosting the body's natural defenses to fight cancer by using materials made either by the body or in the laboratory to bolster, target, or restore immune system function. So some of the specialties and specialists related to oncology are gynecologic oncology, and that's the medical specialty concerned with the diagnosis and treatment of cancers of the female reproductive system. So a gynecologic oncologist is the physician who specializes in the care and treatment of women with gynecologic cancers. Medical oncology is the medical specialty concerned with the use of medical and chemotherapeutic treatments of cancer. A medical oncologist is the physician who specializes in treating cancer with chemotherapy. Oncology, that's the medical specialty concerned with the physical, chemical, and or biological properties and features of cancers. An oncologist is the physician who specializes in the science of oncology. Pediatric oncology is the specialty concerned with the diagnosis and treatment of childhood cancers and blood diseases, and the pediatric oncologist is the physician who specializes in the treatment of childhood cancers and blood diseases. Radiation oncology, that's a radiologic specialty concerned with the treatment, radiation treatment as the main mode of treatment for cancer. And the radiation oncologist is the physician who specializes in treating cancer with the high energy X-rays used in radiation to destroy the cancerous cells. A surgical oncology is a surgical specialty concerned with the surgical aspects of cancer. And then the surgical oncologist is a physician who specializes in the surgical aspects of cancer, including biopsies and tumors, staging and resection. So very often, cancer patient has multiple oncologists if they're getting surgeries, radiations, if they're pediatric, adult, or specialty system oncologists. Abbreviations, AFP, so alpha-fetoprotein, BCC for basal cell carcinoma, BMT, bone marrow transplant, CA for cancer, DCIS for ductal carcinoma in situ, EGFR for epidermal growth factor receptor, ERCP, the endoscopic retrograde cholangiopancreatography, in EUS, an endoscopic ultrasound, FNA, fine needle aspiration, a GIST, that's the GI stromal tumor, HCG, the human chorionic gonadotropin, HIDA, the hepatobiliary amniodiacetic acid, LEAP, the loop electrosurgical excision procedure, an LP and lumbar puncture, an MEN, a multiple endocrine neoplasia, MRCP, the magnetic resonance cholangiopancreatography, NHL, non-Hodgkin's lymphoma, PSA, prostate-specific antigen and RFA, radiofrequency ablation, SCC, squamous cell carcinoma, SPEC, T, single photon emission computed tomography, TRUS, transrectal ultrasound, TURB, the transurethral resection of a bladder tumor, and the TURP, transurethral resection of prostate. And that's it. You've made it through oncology. Great job and good luck studying.